Have you ever left a doctor's office feeling unheard, dismissed, or even doubting yourself? You're not alone. Hello, everyone, and welcome. Today's topic is so important. We're talking about something that too many people experience but rarely discuss. What happens when doctors dismiss you? Now, I want to talk about why this happens, how it affects you, and most importantly, how to trust your own intuition and stand in your truth. If you felt dismissed, it's not because you're difficult or dramatic. It's because the system isn't always set up to listen. Oh, it's just stress, you're told. Oh, it's normal part of your age, or I just think you're reading too much when you come with information. Or they'll say, all these tests, they look fine, they look normal, you're fine. These words can leave you doubting what you're actually feeling. The truth of the matter here is that most doctors are doing the best they can in a system that doesn't support them giving proper care. Oftentimes, if you have something going on, you're sent from one specialist to another specialist, each one only looking at exactly what they're focusing on and nothing else. Until such time that you have a snapshot here, a snapshot there, but who's looking at the whole person? When communication is not happening between the whole, it can lead to many important things happening to you physically that can leave you feeling like you have fallen between the cracks. Many doctors are trained to see data and tests, not the whole person. In so many medical systems, you have time limit appointments, which leave you having to see the doctor in and out in 3 to 5 minutes. That is not enough time for you to actually tell them what's going on and for them to listen and respond appropriately. And whether we want to admit it or not, there are biases. Age biases, gender biases, race biases, chronic illness biases, and all of these things can lead to your dismissal. Studies have shown that women's pain is often underestimated in ERs, and autoimmune disease patients often get misdiagnosed for years. Chronic pain sufferers are often told that it's all in their head. We can't find what's creating pain. Or you're told, it's all, just lose weight. Lose weight, you'll feel better. I'm sure it's nothing. This dismissal isn't just frustrating, it can be traumatizing. And it can leave people afraid to seek help again. Real consequences, misdiagnoses, untreated conditions. I'll tell you what, I've worked with a client who had severe fatigue. And doctors said, your fatigue is all just part of depression. She pushed for tests, but they wouldn't give her any. Until inevitably she found the right doctor who gave her the right test to identify that all of this severe fatigue was not at all depression, that it turned out to be Hashimoto's disease of the thyroid. When you feel like something is going on with your body, you really have to stay with it. I have seen this over and over again. A patient knows that something's wrong, but the doctor can't find anything and sends them home. Months later, it's real, and now it's serious because the issue has shown itself in full proportion. And then they have the nerve to say, oh, well, had we have caught this sooner. You know, it's not about blaming every doctor, but about recognizing that the system isn't designed to validate your knowing. Let's talk about solutions. The solution here is the power of your intuition. Your body is an incredible mechanism, capable of signaling you when something is not right. I can't tell you how many people who, after having a major heart attack, will say to me, I never saw it coming. Really? You never saw it coming? The problem is, people are paying very little to no attention to what is happening in their bodies. And so, no. Their body giving them signals for months. None of those signals was enough to totally stop them in their tracks until such time that a massive heart attack occurred. It doesn't have to be this way. People have no idea that you can and should talk to your body. Talk to your digestive system. Talk to your organs, your gland, your heart, the joints of your body, the muscles. If you actually will connect in and learn to talk to your body. Heart, how are you doing? Do you need anything? Your stomach's upset? Gut's upset? Just put your hand on the area, focus in, and say to your gut, how are you doing? What is happening? And then when you get that sense, that response, pay attention to it. Don't dismiss it, thinking to yourself instantaneously, oh, that response, I think my mind just made that up because that's what I wanted to hear. No, you asked a question of your body. Your body gave you the sense in return. Please don't dismiss it. Please don't dismiss it. Pay attention to all the information you get. When you learn to communicate with your own body, you would be surprised at how well it actually starts to work for you. Let's talk about some intuitive signals that your body gives you. Tight chest. Your gut feels like it flipped. All of a sudden your energy just drops. Do you get reoccurring dreams? Do you get mental pings or flashes of something? These are all languages that your intuition use to try and get your attention. Now, your body, it hears everything. Everything you say. And if your body hears everything, what is it hearing from you? Do you speak well of it? Or do you have times where you're critical or put it down? Do you talk only about the issues that are wrong? This may seem small, but I'm here to tell you that it's much bigger, a bigger deal than you think. Speak well about your body. Put your hand on your gut and thank it for doing such a good job for you. If you are grateful to your body and all that it does for you, you actually will be surprised at how much better it works for you. Sometimes it's things that aren't really that big a deal to you that actually can make a difference. Now, your body communicating with you, giving you signals something's not right. Intuition and that signaling, it's not magic. It's awareness plus your experience. But your knowingness is part of the healing equation. You know, in some indigenous cultures, they expect you to describe your dreams to a healer because they recognize that many times your dreams will give you information about what is going on with you. And so they know and they expect that as part of helping them bring the diagnosis around. Let me be clear. Intuition does not replace doctors, but it complements them. We need all hands on deck to pay attention to this miraculous vessel that we call the body. And if you've ever ignored a little voice inside of you because someone in a white coat told you not to worry, I get it. But that voice in your head, it's your ally. Please don't let it get dismissed by what anybody else says. You are the expert on you. Your intuition is the sum of all your experiences, plus your body's wisdom and even your spirit trying to communicate to help you with your body as well. It's there to help you navigate decisions, not replace your doctor, but to help you choose doctors who will listen, tests that feel right, and treatments that you trust. Again, this is not about ignoring medical science. It is about bringing all your wisdom to the table. So let's talk about a few things that you can do practically before you go connecting in with a doctor or a doctor's appointment. I will always say, check in with your body before you go to the appointment. How is the different parts of your body? How is it feeling? That if there's something that is a concern for you, check in. Again, you may sound silly, but you'll be quite surprised at how quickly your body actually starts to communicate with you. Number 2, prepare questions. Write them down and don't let a doctor rush you. Number 3, document your symptoms. Document. It's amazing how when people actually get in front of doctors that they don't actually share what's going on. The doctor will say to you, well, how are you? And you'll respond, oh, I'm fine. They'll say, well, how, that's good. Are things good? And you say, yeah, they're good. Next thing you know, your session time is done and you realize, I didn't even get to tell them what was going on with me. Keep a health journal. It is the way in which, if you have documentation, it can help your medical professionals help you. And then, of course, number 4, get a second opinion. Don't hesitate about that. If you don't feel right about the conversation or you have felt as though you've been dismissed, go see someone else. Number 5, say no or wait. You can decline treatments if you don't feel that they're right. Number 6, find partners in care. Seek practitioners who respect you. Doctors' offices who aren't shoved through having to do 18 patients, one every 3 to 5 minutes. Don't go to a practice like that. Find partners in care. Number 7, practice self-compassion. I know that this can be hard, but please be kind to yourself. Be kind to your body. Your intuition isn't a luxury. It's essential. Don't let anyone dismiss it. And doctors may have expertise, but you are the expert on you. When you put those together, then real healing can occur. If you've ever felt dismissed or silenced, I want you to know I see you. And you're not alone. Your story matters. When you share it to someone who will listen, who can take it in. If this has resonated with you, please share your story in the comments. Let's build a space where listening to ourselves is normal, valued, and celebrated. And don't forget, subscribe, turn on notifications if you want more videos on medical intuition, healing, and trusting yourself. And if you're ready to deepen your connection to your intuition, please check out my workshops, one-on-one sessions. Let's heal together.